Hello, I'm Richard Kainer, Director of Treatment and founder of Brooklyn Audiology Associates.
And I'm Dr. Max Rubin, audiologist and co-owner. Welcome to Brooklyn Audiology Associates. Please watch the following video message from our colleague, Dr. Keith Darrow.
Stay tuned through to the end for an important message from us and how to get a free copy of my co-authored book.
Hi, it's great to spend a few minutes with you today. I'm Dr. Darrow, and while many of us have worked together in the past, you may be seeing one of my hearing healthcare partners across the country in our Excellence in Audiology member clinics. In my 20 plus years as a clinical audiologist and neuroscientist, I have learned one thing for sure. Everything changes. As I hopefully remember to say to all of my patients when we first begin our journey together, that both hearing loss and tinnitus are chronic medical conditions that require long-term treatment. What this simply means is that the first step you took a few years back will not be the last in order to make sure that you have the most effective long-term treatment for your ears and your brain. You know, advances in the medical treatment of hearing loss and tinnitus, they too are constantly changing, and for the better. Means you'll hear your best. You'll still hear less tinnitus. And while it's our job to keep up on all these changes, and believe me, we certainly do, it's also our responsibility to keep each of our patients educated while on the journey towards better health, towards maintaining confidence, keeping dementia at bay, dialing down the tinnitus, and living passionately independent. Look, I come to you today because everything we do is built around making sure that we have the most educated and most awesome patients on the planet. Secondly, sometimes, if we're being honest, we miss some of the important steps along the journey. And maybe we don't take enough time either on day one or in one of our meetings together to really lay out the long-term treatment plan. I'm talking from A to Z. I'm talking from today through the next decade. So allow me to just cut to the chase. When it comes to your hearing healthcare, there are two certainties of change that we must embrace together. Number one, hearing loss is a chronic medical condition that will get worse over time. Fortunately, it gets worse at a much slower pace because you began treatment years ago. And number two, here's the fun part. All the tools we use to diagnose and treat your hearing loss, well, they get better, which means you will hear more awesome than you already are. Even if you think you're doing okay, trust me, you are going to love the way that you hear again. What this all really means is that it is so important to make regular changes to your prescription about every 3 to 4 years. Think of it like getting your eyes checked every year. Sometimes you have to bump up the prescription so that you can continue to see your best. So let's take a minute to go over the typical progression of hearing loss and tinnitus. And then I'm going to tell you about huge advances in our treatment program that not only will help you hear so much better, but it will also be so much more affordable. All right, let's start talking about the progression of your hearing loss and tinnitus. You know, in all of my years of research and working in the labs at Harvard Medical School, I was able to witness, I'm talking firsthand, exactly what happens as the ear gets older. Let me tell you, it ain't pretty. And while most people think, you know, I'll continue to lose my hearing, this is a normal part of aging, I'm not really worried about your ears. But I'm terrified about what hearing loss and tinnitus can do to your brain long term. You've probably heard this from me before, and from your clinician, that treating hearing loss is the single most important thing that you can do to reduce your risk of dementia. And for good reason, because hearing drives so much of all the activity in our brain and in our memory centers. All right, back to when you first got on this journey. As you might recall, when we first started treatment, there was that adjustment period, you know, the first month or so, when we had to make some changes to get your ears and your brain primed and ready to hear their best. And while we got you to that point, things on the inside, I'm talking inside your ear. They've continued to change, which means your brain has continued to change also. For many patients, the changes that happen over time can be subtle and slow. Perhaps you've started to notice that you just don't hear as well as you used to. And maybe your tinnitus is slowly but surely starting to creep back up. And maybe you're having more conversations where you don't feel as confident in understanding what everybody around you is saying, which really can be pretty embarrassing for many people. Or maybe, just maybe, you're actually one of the lucky few who haven't noticed many of these changes, which is great. And so we can be ahead of the game. We can be proactive about your health and change your prescription before the symptoms grab hold and take over. So even though you took the first step years ago, it is still so important that we continue to catch it early and treat it early. Look, I try to explain to every patient, no medical treatment lasts forever. And that's why my team and I are always researching the best treatment programs for our patients. In fact, we recently completed a large-scale multi-site study that measured patient outcomes in hundreds of ears, and the results were astounding. We actually just had the recent chance to present these findings at several conferences too. And what we found were truly significant and remarkable improvements in our patients' ability to hear everywhere. Trust me, you're going to be blown away by this. So let's dive right in. Here are the 4 big numbers that I need to share with you. All right, number 1. With new technology, our patients hear 40% better when in noisy restaurants or large gatherings. Can you imagine that? No matter how good you think you hear now, when we change your prescription, you are going to hear 40% better in background noise. I got to tell you, I have never seen, actually, I've never heard anything like this before. The new technology that can filter out and remove unwanted background noise is simply incredible. All right, number 2. The data tells us that on average, you will hear 20% more in quiet situations too. So when you're at home or someplace where it isn't, too loud, talking to your spouse or just trying to have a conversation with your grandkids, you will hear so much more of what they have to say to you. It's awesome. Here's the third huge benefit. You know those times when things can get maybe a little too loud? Maybe like a dog barking or screeching brakes, those loud and uncomfortable sounds. The ones that can get in the way of you being able to hear and to have a conversation. Well, this new technology can reduce those loud, annoying sounds by 20%. And finally, number 4. This one is huge for so many of my patients. Our new treatment technology can help you hear nearly 30% more of what others are saying in churches, synagogues, art galleries, and any other large place with poor acoustics. Listen, I've been in hearing healthcare for over 20 years, and I have never, ever seen data like this. Actually, let me say that differently. I have been helping patients hear their best for over 20 years, and I've never seen my patients this happy when they upgrade to our new treatment program. It's like I'm seeing that happy hearing smile all over again for the first time. And one last thing that I promised I would tell you more about, because after all, if this new treatment technology, if I can't get it into everybody's hands, if I can't make it affordable for everybody, well, then it's meaningless. And so that is exactly what we have done. I have been fighting this good fight for so long now, and we finally are starting to win. Look, we have succeeded at making our new hearing treatment programs affordable for all. In collaboration with our partners, we have come together to make sure that patients never go without hearing their very best. And we mean this on day 1 and day 10,001. So let me give you some insight, and I encourage you to talk to your hearing healthcare provider to learn more about the details of this treatment program. This new program enables you to make simple, low, affordable monthly payments. That's right, you will never pay an additional out-of-pocket expense again. This program includes all of your custom technology needs to hear your best. It includes a full lifetime warranty, and of course, it includes our commitment and our guarantee that you hear your best. So, from all of us across the Excellence in Audiology Network and private practices across the country, I commend you for committing to live your best life and fighting back against decline and isolation. Keep smiling and remain passionately independent.
Hi, I'm Richard Kaner, and this is Dr. Max Rubin.
Thank you very much for watching that very important message. And welcome again to Brooklyn Audiology Associates.
When I started this practice in 1980, it was founded on the core principle to treat every hearing loss, its debilitating symptoms, and the cognitive aspects associated with hearing loss to the very best of my ability. Here at Brooklyn Audiology, through over 4 decades of research and case studies, we have developed a proven process for making you hear the best you possibly can.
With the appropriate treatment, you will not only hear better, but we can help reduce your risk of the hearing loss getting worse and reduce your risk for cognitive decline. Rich and I, along with all our providers and staff, will help guide you on your journey to better hearing.
Thank you for trusting us for all your hearing healthcare needs for over 40 years.